You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Annie Fitzgerald, BHC Wellbeing and Member Services Coordinator.
Welcome to the BHC's Be Health Connected podcast. My name is Annie Fitzgerald, and I will be your host for today. In this episode, we continue our conversation around type 2 diabetes, specifically employer efforts to prevent, better manage, and reverse the condition in their workplaces. As the incidence of diabetes increases globally, the fight against this chronic disease continues. And while countless programs are on the market to help patients prevent or manage their condition, Virta Health provides the first treatment to safely and sustainably reverse type 2 diabetes without medications or surgery. To provide some more insight into Virta's innovative program, I am joined by Dr. Jeff Stanley, who is a medical director and physician with Virta Health. Dr. Stanley previously worked as a primary care physician at Kaiser Permanente in Portland, Oregon, where he focused on treating obesity and type 2 diabetes. This experience fueled his passion for helping patients not just manage, but regain their health, and eventually brought Dr. Stanley to Virta. Later on in the conversation, we will also hear from Bonnie Parker, a patient currently using Virta Health, who will provide insight into her success with the program. Dr. Stanley and Bonnie, thank you so much for speaking with us today.
Thanks for having us.
Thank you, Annie.
And so, Dr. Stanley, I think we'll start the conversation with you. Can you tell us a little bit more about the mission of Virta Health? How is it different from other type 2 diabetes solutions on the market for employers?
Yeah, absolutely. So our mission at Virta Health is to reverse type 2 diabetes in 100 million people by the year 2025. So obviously that's a pretty bold and audacious goal, but we've really worked on laying the groundwork to be able to make that happen, and we're confident that we'll be able to achieve it. And to give you a little bit more background as to, what does diabetes reversal really mean? It means basically bringing someone's average blood glucose down below diabetes threshold. And again, that can be daily blood glucose values as well as what's called the hemoglobin A1C, which is basically a 3-month average of someone's blood glucose. But it's doing that, it's getting those normal glucose and A1C values while simultaneously getting people off all of their diabetes-specific medications. And so this is something that's really quite different from what people generally experience with type 2 diabetes. The thought and the kind of common description of type 2 diabetes is that it's a chronic and progressive disease. And really what we're showing through our ongoing clinical trial in Lafayette, Indiana, as well as in our commercial populations, is that this doesn't have to be the case, that people can actually kind of turn back the clock a bit, and normalize their blood glucose, get off of those expensive and sometimes burdensome medications, and really, regain their health. And to give you a little bit more detail there, again, I mentioned our clinical trial. It's with more than 250 folks with type 2 diabetes living in central Indiana. And our results that we've seen there have really been phenomenal. So we've seen that more than 60% of people in the trial reverse their type 2 diabetes, and we're able to sustain that over time. We've also seen very similar and even better results in our commercial population. The other thing that's been great to see is that, beyond that 60% who's able to reverse diabetes, we also see that the other 40% are seeing some really nice improvements in their health. So those people are getting on significantly less medications. Their glucose is now, out of the high risk, high level, and down in a more well-controlled diabetes range. And then we're continuing to work with those folks over time to hopefully bring them into the reversal range. And again, when you're looking at the way that this differs from what people would experience in the community. So again, most people when they're diagnosed with diabetes, what they experience is that over time they get put on more and more medications. The costs increase for them as well as for their employers. And then also their glucose continues to go up despite their best efforts. And in addition, they're seeing their doctor, maybe every 3 months at best, maybe 6 months or a year for a quick 10 or 15-minute visit. They might get referred to a dietitian where they'll get a pamphlet or a quick consultation and then kind of sent on their own to make these big changes. And so what really differs in what Virta is doing is we have this digital platform where we have a fully virtual physician-led clinic for medical supervision. We have the ability for our patients to interact via our app with their health coach, oftentimes multiple times within the same day. And what we do is we help them to follow kind of a personalized carbohydrate restricted diet, which allows them, again, to quickly improve their blood glucose and get off of medications. So it's something that, quite frankly, is pretty much impossible to do in the community. I mean, I tried as a primary care doctor and just didn't have the infrastructure to be able to closely monitor people as their glucose improved, or to have somebody who could be working really closely hand in hand with a patient to help support them through these lifestyle changes and to be there when things get a little bit rocky and you need that extra support.
Right. That's, it's great. It sounds like Virta Health is a very high touch solution for employers and their employees. So, you mentioned health coaches and, using the app. So how does your role specifically fit with Virta Health's program?
Right. So as you mentioned, I'm a medical director as well as a practicing physician with Virta. I've been on the team for almost 5 years now. I'm licensed to practice medicine in all 50 states. And so it's really interesting. I get to treat people across the country from all different walks of life. And with telemedicine, I actually get to have a cool little view into their home and their family and their pets even. So, and my role as a practicing physician, again, is that when someone joins the Virta treatment, like Bonnie, they would go through the enrollment process and basically enter some data, get labs, and then they would see myself or one of my colleagues for their telemedicine visit via video chat. So we're going through their medical history. We're learning about kind of what makes them tick. I always ask everybody what's kind of a fun hobby that you have or something that's weird or interesting about you. And then we approve someone to start once we get all their medications, their medical history. And then they'll be working again closely with a coach to figure out, how do I reduce my carbohydrates? How do I improve my glucose and stick with this? But during that time, they're getting supervision closely by a physician. And what that looks like is they're entering their blood glucose markers, and those are basically sent to me and my colleagues. And based on those numbers, we have kind of an artificial intelligence driven algorithm that lets us know, hey, Bonnie is doing really well and she's due for a medication reduction. And that's one thing that's actually probably the most important part of my job, other than getting to deliver awesome news to people that they get to stop their meds. But really on a day-to-day basis is about keeping people safe. So when someone changes their lifestyle, their diet, if they don't have that supervision and their glucose goes from the high range down to the low range, but they're still taking their same amount of insulin, they could have a dangerous low blood glucose. And so what we're really laser focused on is seeing, as the glucose, it's not even getting low, is as the glucose is improving rapidly, we reduce someone's insulin so that they stay in that safe range the whole time.
That's great. And, you mentioned, helping employees get off of their medication. So, from your perspective as a physician and your history prior to Virta Health, why is medication deprescription such a critical piece in treating type 2 diabetes?
Yeah, I mean, medication deprescription, it's quite honestly and the best part of my job. And it's something that, again, it's so impactful for an individual patient. If you can imagine someone who's been on insulin for 10 years or 15 years, every day injecting themselves with insulin, checking their blood glucose 3 or 4 times a day, and struggling with highs and lows and when to eat and all those kind of things. And to be able to tell that person, hey, guess what? Your glucose is now totally normal and you don't need your insulin anymore. sending that message or delivering that to people. It's funny. I mean, it never gets old. I do it all the time, but every time I do it and the response is, I'm crying right now, the patient tells me, or, this is the best day of my life. I'm sure aside from, the birth of their children or their wedding, but it is, it's a really impactful day. So, and then moving forward, it's something that helps motivate people to stick with the lifestyle changes because they know that they don't want to go back on the insulin or on the other medications. But then we're there with them, every step of the way, kind of supporting folks because it's not always a smooth process. There things happen in life. And so that's a big part of what the support is about, is understanding that people are human and that they're going to need more and less support at different times and really working on that. But again, I think this idea of deprescription is pretty foreign to most physicians, unfortunately. In my time as a primary care doctor, probably was a handful of times that I was able to take someone off of medication. But I was thinking back, like a couple of weeks ago, I had a really busy, nice Monday where I realized that I had taken 6 people off of insulin in the 1 hour in the afternoon. And it sort of dawned on me that this was something that was so different to what I'd expected in medicine and
Right.
really what medicine is like for most folks.
Wow. I mean, that's really special to get the opportunity to, share that great news with patients so often. And, you mentioned the idea of medication deprescription being foreign to physicians, and you can only imagine it's even more foreign to employers, when they're, seeking out programs to provide to their employees to help them, manage their chronic condition. I don't even think reversal is even something that is thought about. And so I think, introducing the Virta Health program to employers is a great way to, show them that it is possible for their employees and, that will not only, affect their employees' health, but also, the employer's bottom line in the end. So, like I said, I think that's really special.
Yeah, I mean, that's something that we hear again and again in our discussions with employers and with health plans. And it's been interesting. Again, I said been with Virta for almost 5 years now. And, the early discussions, there was a lot of skepticism of, you're going to do what? and honestly, things like having the clinical trial and having a large group of employers who are seeing this benefit has really made the job luckily easier over time. But again, it's something where it really is kind of a whole new category. Most companies are thinking about diabetes prevention, which of course is really important, or they're thinking about diabetes management. But the thought that someone who's been on these medications for years and years could actually get off them is honestly, it's pretty foreign to people. And, that's really where I think where we see the differentiation between ourselves and other, digital diabetes options is that a lot of other options are really focused on getting people to check their glucose every day, reminding them to take their medications and get their refills and, check in with their doctor. But because they don't have the physician supervision, or again, because it's really focused on management, the possibility of stopping a med just isn't really on their radar.
Right. Yeah. And, as we've moved through our Defeat Diabetes STL campaign, we've tried to stay, up to date with the recent, recommendations by the American Diabetes Association. And, we know that last year they released new standards of care that endorsed medical nutrition therapy as a first-line treatment for type 2 diabetes. So I'd love to hear about Virta's philosophy on nutrition therapy. What kind of diet recommendations does Virta endorse?
Yeah, so it's been, again, really exciting over the last couple of years to see the American Diabetes Association, embrace medical nutrition therapy as really a first-line treatment. A lot of times it kind of gets paid lip service a little bit in that, the idea is, okay, first, of course, you would change your diet, but when that doesn't work, then these are the meds that you'll take. And there's really been a new emphasis on saying, actually, there are ways to reverse diabetes or put it in remission through dietary changes, and we should be giving patients the opportunity to do that. So, again, what the guidelines have said over the last couple of years is basically that there are a number of approaches with medical nutrition therapy, and that really it should be personalized and patient-centric. And they actually cited our clinical trial, our peer-reviewed literature, as support that carbohydrate restriction is one of the viable options that's effective for people, and that it's a really effective way to improve blood glucose and even help people to get off of medications. So that was, again, really exciting to see and rewarding given the work that we've been putting in over time with the clinical trial. And it's, again, really changed the discussions that I'm having with buyers in terms of understanding that this is endorsed by the American Diabetes Association. This is mainstream, this is something that's safe and effective for patients. And one of the things that's actually really cool along with the guidelines changing is that the former chief medical officer of the ADA, Dr. Bob Ratner, has joined Virta as our chief medical officer. So it's just kind of more validation that this is an option that's really safe and effective for folks, and that it's becoming more mainstream. So in terms of the specific nutrition recommendations that we use at Virta, again, we use what we call kind of personalized carbohydrate restriction. So we know that carbohydrates like starchy foods, bread, potato, pasta, or sugar are really detrimental in terms of blood sugar control. So those are foods that I think common sense wise people can know that when you eat these high carbohydrate foods, blood glucose is going to go up. So we focus first and foremost on reducing or eliminating those foods as much as possible. And then we work with people to personalize, what's the level of carbohydrate restriction that they can stick with. And also what is their particular metabolism need. So some people are somewhat lucky and they can tolerate a higher amount of carbohydrates. And other people, again, they've had diabetes for 20 years, their body is not very forgiving, and so they need to keep those levels lower. But we use the data that we're getting in terms of blood glucose levels, in terms of their, people's weight loss and medication needs, and we use that to help tailor it to the individual. And also, again, really most importantly, to make it sustainable, because if something happens and, again, if somebody has quick improvement in their glucose over 1 or 2 months, but then they go back to where they were, that's not really what we're about. We want to help people maintain these changes for years and hopefully for life.
Right, that's great. And, in an effort to maintain those changes, you mentioned having the telemedicine visits with your patients on the Virta Health program. Can you tell me a little bit more about Virta's telemedicine platform?
Yeah, so one of the things that we knew from the beginning of starting Virta was that we wanted to be able to treat patients across the country and not have geography be a barrier, whether someone lives in a rural area or certain parts of the country where it can be difficult to see a doctor or a diabetes specialist. And so really from the beginning, we focused on a fully virtual medical clinic. Again, we're licensed to practice medicine in all 50 states. So someone is able to establish care with a provider like myself and to, have their medications managed and, again, establish that doctor-patient relationship. And what we also found is that the traditional tools for taking care of patients just didn't really apply to what we do. Again, in the standard kind of brick and mortar episodic care world, what you're seeing is that, again, someone sees their doctor every 3 to 6 months, they have one visit, get their recommendations, the doctor bills, and that's it. But what we saw is that we're interacting with patients on a daily basis. We're sending text messages, we're having video visits and phone visits. And so we really had to build our platform from the ground up to be able to focus on outcomes, to focus on interacting with patients regularly and not focus on billing fee for service. So that actually brings up another interesting point in terms of the way that we do bill. It's where we get paid 100% for performance. So when a patient signs up with Virta, basically there are performance guarantees through their employer, which include reductions in hemoglobin A1C, weight loss, and reductions in prescription medications. And if we don't hit those benchmarks, then we refund that portion of the charge to the employer. So we're not billing because we see someone for a visit. We're only billing when we're seeing success. And that has the kind of the added benefit of, again, with the success that we're seeing, like getting people off of 60% of their diabetes meds, that's showing cost savings for the employer. So they're actually seeing that despite these improvements in health, they're actually saving money because of the reductions in medications, the reductions in claims, and just the increased and improved health in their patients.
Right, that's great. I mean, clearly you're confident in the program, and has been proven in the studies that you mentioned earlier that it can be very successful. So you mentioned, the fee-for-service application for employers. Can you talk a little bit about how Virta Health works with employers and kind of what the program implementation looks like if an employer were to utilize the Virta Health program?
So Virta works with more than 100 self-insured employers and health plans already, including some BHC members, Concordia Plan Services, Doe Run, and Bass Pro Shops. And the way that we work with these self-insured employers is basically, a company decides that they want to offer Virta to their employees as well as often dependents. And we go through a process of getting linked up. But one of the things that's nice is that we can bill through claims, which means that there's no setup costs. There's no the kind of sometimes onerous process of getting set up through a vendor. This is something where we can really quickly kind of link up and start treating people with type 2 diabetes or prediabetes. And generally what happens when we're rolling out with an employer is, we'll be able to send out some co-branded emails that go out to employees who have type 2 diabetes or prediabetes. And one of the things that we found is really powerful is the messaging that we're able to send out, and that we can, tell people, ditch your diabetes meds, or, what if your diabetes was reversible? And that kind of messaging can sort of cut through some of the noise we've found. And someone reads that and says, wow, I didn't even know that was a possibility. Like, no one ever told me I could get off of my diabetes meds. And we're seeing that, then as employees enroll, oftentimes their coworkers are seeing their success. They're saying like, wow, what's Bob doing? He's lost 20 pounds and he's looking really good. He's got great energy. I want some of what he has. And so we've seen that with employees where, sometimes there's a couple of the early adopters who join. And then as people see the success of their colleagues, that we get more and more people up to, some of our enrollments where, more than 50% of eligible employees are doing Virta. So everybody knows about Virta. People are, helping their colleagues to make better dietary changes or not bring the donuts into the office and things like that.
So that's great. So I think, thinking about the way that you work with employers, I think a lot of our employer members are thinking about the impact the current pandemic has had on their workforce when they're looking for new programs to implement. And so can you talk a little bit about how Virta Health has, helped patients during these unprecedented times?
Yeah, I mean, it's obviously been an extremely challenging time for all of us. And, I was frankly a little bit concerned when when it became clear initially that this was going to be a big deal for folks, whether our patients would really struggle during that time. And one of the things that has been really a pleasant surprise is that we found that people have actually really taken to telemedicine during this time. They've also really been able to understand that diabetes is a huge risk factor for complications or even death from COVID-19. And so a lot of people are taking this really more seriously than they were in the past, and understanding that this isn't something that they can put off until things get less busy or until they're motivated to make a big change. And again, so what we're seeing is that with COVID-19, again, there have been a number of studies that show this increased risk. And there's one study in particular in China that showed that people with poorly controlled diabetes have as much as a 10 times higher likelihood of dying from COVID within the first month of being diagnosed. And we know that our patients are scared about that, and they're reading this information in the news or hearing about it from people. And so one of the things that we've been really excited about is that, we feel like we're kind of perfectly poised to help people during this time, in that we're 100% virtual. So somebody doesn't need to go in and see their doctor if they're worried about being in a busy waiting room and being exposed to other people. They can do the enrollment process. They can get started, without leaving the comfort of their own home. And then they can get this ongoing support during a time when a lot of people are feeling, somewhat socially isolated. So we've seen that, there have been things that we had to fine tune during this time. Again, offering people a lot more, I think, emotional support and community. In addition, working with people to say, here's what you can buy in bulk that is not going to raise your blood sugar. Or here's, you're an essential worker and you've got to go into the workplace. Here are ways that you can be safe. Here are ways that you can improve your health so that you're as robust as possible should you be exposed to COVID. So, I think there's really a number of ways that we can kind of help to address these needs that come up during the pandemic. But we found in general that, again, this just offering support, being there for patients, and really meeting them where they are during a tough time.
Right. That's great to hear. And, while we're on the topic of patients, I think now is a great time to pull in Bonnie Parker, who I mentioned is currently using the Virta Health program and has been since February of 2019. Bonnie, once again, welcome.
Thank you, Annie. It's great to be included in this today.
So I'd love to hear a little bit about your background. How did you find out about Virta Health?
Actually, I kind of grew up in what could have been the poster family for type 2 diabetes. My maternal grandmother, my mother, my brother, and then my father were all type 2 diabetics. And my primary care physician had really prepared me for the fact that I was going to be diabetic and dependent on medications for the rest of my life. And so, of course, the diagnosis came, and I got a 45-minute scheduled time period with a dietitian to talk about what I was supposed to eat. And I was put on medication. And over the course of the next 15 years, my medications changed and increased until I was on 3 non-generic medications. And in January of 2019, our prescription management program at work had changed, and I ordered my first 90-day supply of one of my medications. And when I saw the cost was $900, I was not a happy camper. And I actually complained to a friend of mine in accounting who actually sits on the wellness committee for the organization. And I was not the first she had heard from. So at the next meeting, she mentioned the dissatisfaction and came back and referred me to Concordia's website, which actually offered 4 options available to pre-diabetic or diabetic patients. And that's actually where I found Virta Health.
That's great to hear, that you had a connection with one of your coworkers that was able to guide you to the program. My eyes kind of bulged out when you mentioned that $900 bill as well. So I would imagine, yourself paying it, that would be quite, concerning to see. So, since joining the Virta Health program, how has your experience been? What kind of results have you seen?
Well, I'll tell you, my expectations and my results are way beyond my wildest imagination. And truthfully, going in, I wasn't sure what to expect because I was so preconditioned to the fact that this was just like a life sentence for me and how it was going to be. And so I've been obviously pleasantly surprised by all aspects of the program. When I started in February of 2019, my A1C that Dr. Stanley talked about was over 8. And I get a weekly summary on the app every week based on performance and how I'm working the program. This week, my A1C range was between 5.9 and 6.5, which makes me very happy. I've discovered along the way that this is really complex, and I learn every day because the impact on your overall being is amazing. And now, of course, I eat food for medicine. You're not taking medicine. And the program doesn't just deal with carbohydrate restriction and medications. It really deals with me as a whole person. And that means emotionally and mental health. And there's so much going on. Your life continues no matter what. And especially with the onset of the pandemic, there's so much going on for so many of us. And of course, now self-care is a big topic. And I've said to a number of people, I will just tell you, I think Virta Health is the best possible self-care plan I could take advantage of. When I first started, I was 2 months into the program and off all my medications. So I was a very happy camper at that point. But then I received a breast cancer diagnosis, and I was very fortunate. It was stage 1. I had 2 surgeries and radiation. But my big concern was I knew that Virta was paid based on success of the program. And I was worried that my numbers might skew that success and they might kick me out of the program. So when I mentioned that to my coach, I believe she reached out to my Virta doctor, who was kind enough to schedule video time with me to review my pathology and to really talk me off the ledge and reassure me that while this might represent a bit of a setback, we would get through it together. And that was a huge help for me, and I think is just symbolic overall of what I get from Virta. Almost every Virta employee that I have contact with, the mantra seems to be, we're here for you. And that isn't just something they say, it's something they live every day. They are all driven to reach the goal of helping individuals like me become much healthier than pre-Virta.
Bonnie, that is such an inspiring story. And, we're so glad to know that you're in good health right now. And, you mentioned meeting with your doctor, and then also kind of mentioned your health coach. So by chance, is Dr. Stanley your doctor with Virta Health?
He certainly is. And I will tell you, with what I've been through in the last year, I have a whole cadre of physicians, and all of them, with the exception of Dr. Stanley, are local. But he remains the one who is probably most accessible to me and willing to have conversations about how I'm feeling, what's going on with me, what the impact of my health might be at any given time, and help me see what's real and what isn't. And that has been just huge for me.
That's great. And you also mentioned a health coach. How is your relationship with your health coach different than your relationship with Dr. Stanley?
My health coach is available to me every day. And initially, contact with my health coach is numerous times in a day. And then as you work through the program, it's not quite as frequent. However, we're still in pretty much constant contact, and she is my connection to Dr. Stanley. If there's anything she even senses that I need from him, she reaches out to him and he engages. But my Virta Health coach is really more of a life coach than a Virta Health coach. She's a very intelligent young lady, well-educated. I admire her and respect her. And she has done a lot for me in terms of my whole being and that self-care that I talked about. She's introduced me to resources I probably would not have found on my own that impact my emotional well-being. A prime example would be Brene Brown, who is a social worker who is heavily invested in the subject of vulnerability, and we all see being vulnerable as a weakness, and she's very clear being vulnerable is a huge strength, and those of us who are willing to be vulnerable and put it out there will take flack, but we will also gain the most from that. So through TED Talks and whatever it might be, inspirational messages or graphics or whatever it might be, my Virta Health coach is truly for me a life coach and has added a whole new aspect to my life, quite honestly. And I really do appreciate all that she has brought to my experience.
That's great. We know that having strong social connections can really impact your health in a positive way. So to know that the Virta Health program, provides support not only from a physician, but also from somebody like a health coach is great to hear. And, Bonnie, before we close out, I just want to thank you for providing this, wonderful testimonial for the Virta Health program. And I just have one last question. If someone were on the fence about participating in the Virta Health program, what would you tell them?
I wouldn't question it in the slightest. As I said, I didn't know what to expect. I couldn't imagine it would work. There are so many aspects. The app, the contact with the health coach and the doctor. Virta offers so many resources, and they've been so responsive with the pandemic. They offer even more blog posts and webinars and studies and trials, just so proactive and driven in their mission. I would strongly encourage anyone who's even considering it to at least take the step and investigate it and go for it.
Great. Those are, great thoughts on the program. I wanted to, thank Dr. Stanley and Bonnie so much for joining us today for our podcast. Before we sign off for the day, do either of you have any closing remarks?
I'm the Virta patient that doesn't hold back. I would encourage all of your members to seriously consider the impact they can have on their employees. My employer not only offers it, but they cover the cost for me, which is just a blessing. And I'm healthier now than I've been probably ever, all as a result of that. So please investigate and take advantage and do the good deed for your employees.
Yeah, I don't have a whole lot in addition to add to the great words that Bonnie had there, but I did just want to again encourage people to think about offering this as an opportunity to employees. This is something that truly can transform people's lives, to give them the opportunity to get off of their diabetes medications, to normalize their blood glucose, and not to feel really controlled by diabetes. And the great thing is that you can do this while also saving money and improving the health of a large group of people. So thank you so much for taking the time to chat with us, Annie. I really enjoyed it, and always nice to see you, Bonnie.
Oh, thank you, Dr. Stanley, for putting up with me. And Annie, thanks for having me.
Of course. Well, once again, we look forward to continuing our partnership with Virta Health and continue to support employers with their workforce health needs. Once again, thank you, Bonnie and Dr. Stanley. We hope you have a wonderful rest of your day.
Thanks, Annie.
Thanks, Annie.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.